I know just from my own experiences that seeing what comes in every day is reality. My name is Dr. Molly Rutherford. I am specialized in addiction medicine and family medicine. I'm seeing some harms from the response to this virus, and I'm not seeing very much harm from this virus. And that's my perspective. I realize that a frontline physician in the ICU or in the emergency department in New York City is going to have a different perspective. But when you live in a county like mine, where the prevalence is extremely low, it doesn't make any sense. It's kind of maddening. And I do have a background in infectious diseases. In fact, I worked for Dr. Fauci from 1996 to 1999 as a policy analyst at the National Institute of Allergy and Infectious Disease. And then I also have a master's in public health from Johns Hopkins University in epidemiology. So I'm able to look at those numbers and think critically about them. And when I watch our response to this, it just does not make sense, at least not here where I live. The NIH, the National Institutes of Health, is very much separate from a lot of reality. I would say that if I was still working there as a bench scientist or a policy analyst, I would not have the perspective that I have now, married to a police officer and practicing in a relatively rural area treating addiction. So I have the science background, but I also have a very unique outlook based on my own personal experiences. I know that being on the front lines, practicing primary care, seeing what comes in every day is reality. I think that the consequences in terms of mental health for many of my patients and many people throughout this country are devastating, and it's going to get worse the longer that we keep our economy locked down. The big picture in this COVID-19 pandemic is maybe we had to take those steps early on when we did not have the information to try and flatten the curve. This has gone on too long, however. The morbidity and mortality from joblessness and from mental health crises and relapse and suicides, homicides, shootings, all these things are just going to continue to get worse. And they're going to dwarf the effect of this virus, in my opinion.